Cynhadledd, good afternoon. I'm Andrew Goodall, Chief Executive of NHS Wales. Today I'll update you about how coronavirus is affecting the NHS. Over the last month, we've seen a noticeable impact on NHS capacity and services. We have 4 levels of escalation in the NHS, which reflect pressures in the system. Today there are 11 hospitals reporting levels 3 or 4, which shows the increased pressure across the NHS. The NHS continues to balance normal winter and emergency pressures with the demands of looking after people seriously ill with coronavirus symptoms. There are currently 1,275 COVID-related patients in Welsh hospitals. This is 18% higher than last week and the highest number since late April. 1 in 6 people in hospital beds are there because of coronavirus. This is now only 9% lower than the peak we saw in April. When I spoke to you last, I said I was concerned about this rising trend. I continue to be concerned. We expect demand for hospital treatment for people with coronavirus to continue to increase in the days and weeks ahead. It will take time to see the full impact of the national firebreak to work its way through the NHS. There are currently 57 people being treated in critical care for coronavirus, 12% higher than last week. About a third of our critical care capacity is now being used for coronavirus patients. Our normal critical care capacity of 152 beds is full, mainly with people who do not have coronavirus. We currently have 163 people in critical care at the moment. We do have plans to expand critical care capacity if it's required. We estimate nearly 16,000 people have been discharged from hospital after being treated for coronavirus since the pandemic started. People admitted to hospital with coronavirus will typically stay twice as long as other emergency admissions, which has a knock-on impact on available bed capacity. I want to turn now to coronavirus and transmission in healthcare settings. The evidence shows that when COVID is spreading quickly and widely in a community, it can rapidly and easily enter a closed setting like a hospital, where it can be quickly spread. We regret every case of hospital-acquired COVID, but I want to be clear, this is not as simple as a failure of hand washing or poor infection control procedures. This virus is highly infectious and it can be passed on in the asymptomatic, pre-symptomatic and symptomatic phases of the infection. It is incredibly difficult to prevent its spread in busy healthcare environments, especially with around 90 people with COVID currently admitted each day. Hospital transmission rates in Wales have increased over the last 2 to 3 weeks. Last week, there were 192 cases of probable or definite cases of hospital transmission in Wales. This is equivalent to 1 in 40 of the confirmed cases reported nationally. Everyone admitted to hospital is tested, and 6% currently have COVID on admission. The rate has been highest in Cwmtaf Morgannwg University Health Board, where community transmission is also at its highest. But even here, hospital transmissions account for just 3% of the total cases in the area. Despite hospital transmissions, over 85% of our available beds do not have coronavirus patients, so care remains safe for the vast majority needing to access hospital. All health boards have detailed plans for the prevention and the control of COVID infections in hospital. I want to say a few words about NHS activity. You will remember that at the start of the pandemic, we postponed planned operations and appointments to help the NHS. But essential services, including cancer and mental health and emergency services, continued. We have been restarting and restoring activity across the NHS since lockdown ended. This means that the NHS is now busier. It has more than twice the number of non-coronavirus patients in hospital beds than April, because we have been able to admit more emergency and planned patients over recent months. While the number of people with coronavirus is moving towards the April peak, our information shows the NHS is doing more planned activity than it was in the spring. Planned inpatient and day case admissions in September have increased by more than 160% compared to April. Cancer referrals have returned to expected levels, and treatment activity was higher in August than in April. The number of new outpatients seen, whether face-to-face or remotely, was 75% higher in September than in April. Primary care services in GP practices and pharmacies have been open and available all year round. We have also now restored other activities in primary care. The flu vaccination programme has had a successful start with a larger uptake already than last year. In dentistry, more than 300,000 people have been treated since March. Just last week, around 22,000 people were seen in person in practices, and a further 6,000 received remote advice and follow-up advice. Community optometry activity continues to increase. 38% more patients were seen in September compared with July. But not all of our services have returned to their normal levels. Delivering normal NHS services in an environment where coronavirus is widespread in our communities makes this very difficult. Providing safe care is always our first priority. The protections we have put in place to respond to coronavirus take more time and slow down the number of patients who can be seen and treated. This means that across the UK, the NHS is seeing waiting times increase and the waiting list grow, and this is our pattern in Wales too. We will continue to do all we can to see and treat patients, but this will need a much longer term response. For this reason, we continue to focus on clinical priority and the urgency of patients needing to access our services. I am very grateful to all our health and care staff for their commitment and for everything that they are doing to respond to people's needs in the most challenging of circumstances. They have had little or no respite from pressures over recent months, yet have continued to maintain our health and care services. And I would like to pass on my personal thanks to them all and for their commitment to patients. Our plan is to continue to respond to coronavirus pressures in the NHS, maintain emergency services, and as much NHS activity as possible for as long as is possible. We want to ensure that the NHS can balance its emergency response alongside services we have gradually restored. But the higher the level of coronavirus in the community, the more difficult this is to achieve. This will be a difficult winter, and we will continue to support the NHS to prepare and respond. It's important that we all play our part and do everything we can to look after ourselves and each other. It's important we all follow the rules, we keep our distance from each other, practice good hand hygiene, work from home where we can, and wear a face mask in indoor public places. By doing this, we can support each other and our NHS and care services in the weeks and months ahead, and we can protect the broader range of activities we have reintroduced. Together, we will keep Wales safe. Thank you. Diolch yn fawr iawn. In the normal way, I'm going to go to questions from the journalists, and starting today with Owen Clark. Owen, prynhawn da.
Prynhawn da, Dr. Goodall. To justify the lockdown in England, the UK government pointed to some worrying stark analysis, even suggesting hospitals in England could be overwhelmed in a matter of weeks, despite extra capacity. What are your projections in Wales, whether it be worst case scenario or mitigated by the firebreak lockdown? And we also hear of GPs talking about being under unbearable pressure. So do you agree this simply isn't a case of hospitals feeling the strain?
Diolch, thank you, Owen. I hope that in describing NHS activity today, I've tried to demonstrate that this is about how we support patients through our whole system. And it's really important to recognise the volume of cases and patients who are being seen in community settings alongside the hospital setting. And it's absolutely right that we should acknowledge the extraordinary efforts of GPs and other primary care professionals for the way in which they have supported the care and treatment needed for our Welsh patients. If I was looking at recent activity levels for GP activity, it's in line with what our normal levels would be, compares with last year. And they have adopted and adapted a range of different approaches and technologies to actually make that happen and to support staff. So I would absolutely agree with you that it's really important to make sure that we are supporting all elements of our system in an appropriate manner. My response on the pressure that the NHS is under at the moment, I'm obviously in daily contact, if not more frequently, with the NHS right across Wales. I was talking to chief executives yesterday, for example. One of our concerns, Owen, is of course that we are having to respond to modelling that still says that if we're unable to break the chain of transmission, there could well be very significant increases in both hospital admissions and deaths right through the whole winter period of time. And clearly the actions that were taken by Welsh Government with a national fire break are in line with needing to do something very different from a society and a community perspective to protect the NHS. As we look at our current numbers, you'll have seen in my overview as I was speaking that we're getting now very close to the peak levels that we saw in April. I don't think that the peak that we saw in April represents the NHS being overwhelmed, but I think it's a very visible milestone to demonstrate the significance of the impact that we're going to see across the NHS system. But the NHS is more prepared. We have got plans in place, and that does include our ability to expand additional capacity, working with the plans from the individual health boards across Wales. Based on where we are at the moment, we are obviously tracking the data on a daily basis. I think it's inevitable that over this next week, we will see our figures get to the levels that we saw in April. Having said that, there are still available beds within our system to be used today, and we still have the ability to expand into additional beds. I think that the next 2 to 3 weeks are pretty important for us, and we need to review the data that is telling us about the impact of the fire break and also the potential impact of the earlier local restrictions. And we are hoping that we will see some evidence of some stabilisation, Owen. But on the numbers, if things carried on going as they are, inevitably the NHS in Wales, would get to a point where it does become overwhelmed. But my discussions with the chief executives in Wales and also with other professional bodies is a wish to make sure that as far as possible we can maintain the range of NHS activities rather than just revert to where we were in March when we stepped away from routine activities.
Thank you very much. You mentioned hospital infections in your opening statement, hospital-acquired infections, people catching COVID in hospitals. We know of the situation in Cwmtaf Morgannwg being a problem for many weeks, but we also see rates rising dramatically in the Aneurin Bevan Health Board in South East Wales and Swansea Bay Health Board as well. What prospect have you got of getting this under control? And you say it's not a failure really of infection control measures, but surely that is part of the problem.
I mean, clearly there is a connection point between just seeing growth in prevalence across Wales and the number of cases in our communities, because inevitably that will affect patients who are being admitted at this stage. So looking at the Cwmtaf Morgannwg experience, whilst the number of patients admitted into hospital with coronavirus is around 6% for the whole of Wales, it's actually 15% for Cwmtaf Morgannwg. So there is a connecting point. But it's really important that we can ensure that we are discharging all of the appropriate practices in place, that we are enhancing that we are learning from experiences across the UK, indeed internationally, and ourselves in Wales, which is why Public Health Wales have been supporting health boards across Wales with a 16-point set of actions, which are there to ensure that we can reduce the level of transmission that is occurring. In normal circumstances, in our infection control practices, we normally can see that if we're able to get about 90% compliance on the range of areas, we will see some of the normal winter bugs, for example, that break out coming under control. Coronavirus almost needs the system for people, for staff, to be 100% complying 100% of the time. So whatever good infection control policies and procedures are in place, we need to make sure that we can continue to respond to this. And I think my general message, Owen, is of course I would have an expectation to look to contain and control these areas. We have had evidence of that across Wales with other hospital areas that have been able to do so over the course of these recent weeks. But we need to make sure that we can continue to focus on the links that happen in terms of what is happening generally with our communities. And that's why we are asking our communities to work with us and to understand that they can help the NHS by actually undertaking their own activities and practices like hand hygiene and social distancing.
And finally, Dr. Goodall, and many thanks. Are you considering scenarios where you would have to postpone on an all-Wales level some of the essential services of the NHS, as happened in the spring? Are you considering that scenario where you would have to do that centrally across Wales?
Yeah, Owen, we have to consider a range of scenarios. One of the reasons for introducing the particular action back in March was because we needed to give time to the NHS to prepare, to train staff, and actually to be able to ensure we had available capacity if it was needed. And I think we are in a different situation at the moment, which is why the general feeling from the NHS in Wales is a wish to look to protect the range of activities happening as much as possible. But if the numbers continued and we continue to see an increase in activity in coronavirus patients coming through our system, then inevitably there is a point when we have to focus on safety and emergency response. I don't feel that we have reached that point yet. And certainly in my discussions over recent days with the NHS, we are aware that there may be a need for future national actions. Most importantly at the moment, however, is still to focus on things that can make a difference. And that's why the National Firebreak has been an action that has been welcomed by the NHS in Wales to help us with the level of spread within our communities. Thank you, Owen. Diolch yn fawr iawn. Just moving next to James Crichton-Smith from ITV Wales. Good afternoon, James.
Afternoon, Dr. Goodall. Thank you. Why are you confident that lockdowns like firebreaks work when the likes of Caerphilly and RCT, who went into renewed measures first, both have still among the highest COVID rates in Wales?
Well, two comments I would make, James. I mean, firstly, obviously from a government perspective, we're looking at how the firebreak generally can have an impact by bringing together different sectors in response rather than just relying only on an NHS response. And clearly the firebreak is there to make sure that there is a contribution from society more broadly. The level of the national firebreak is different and enhanced from the local restrictions, but you're right to make the point that there would have been restrictions in those areas that perhaps haven't had the impact that we wanted. But from our perspective, we can see that it did help to actually slow down some of the potential transmission that was occurring within those communities at this stage. What we do know is that in terms of actions that made a difference and our ability to respond, that the national set of actions that occurred back in March had a very significant impact on the trend that was happening for the NHS across the UK and in Wales itself. So as well as us trying to prepare and professionally respond to the pressures that we were facing at that time, and I have always through these press conferences just tried to recognise that a lot of the impact came from actually the behaviours of people, individuals, communities and society. So the reintroduction of a firebreak under that kind of level, similar to what we experienced in March, we would hope and expect has the same kind of impact. And that's been the basis of the professional advice that's been provided across Welsh Government.
Thank you for that. What measures then are being used to determine whether this firebreak has worked? And what do those measures, what levels do those measures need to get to in order to be able to turn around and say, yeah, right, we've been a success here? Is it the R rate? Is it the percentage positive? Can you give us some clarity on that?
Yeah, thank you, James. So the intentions of the firebreak have been to focus on various areas, if I can tie them to my own sector and my own level of experience. They are a package of measures intended to get the reproduction rate below 1, and we of course are tracking whether we can see that convert in that way. We are looking to make sure that we're able to ensure the NHS is not overwhelmed, but more than that, we've been looking to ensure that the NHS can carry on this range of activities that I've been describing. So if I talk generally, we have been tracking at a Welsh Government perspective examples of whether mobility seems to have changed, the travel arrangements of members of our community over the last couple of weeks, can that act to translate? But my greater interest is understanding and looking at the impact on the NHS and what we're seeing at this stage. So clearly tracking the level of positive cases in our community and the general level of prevalence alongside the reproduction rate is quite important. I have an interest in tracking what is happening on the NHS side in respect of hospital admissions. Are they stabilising? Are they reducing? I have an interest in seeing how long patients are staying as a length of stay within the hospital environment. Is that shortening? Does that mean that we have more capacity available? But two particular areas which are more difficult but represent the more seriously ill patients are actually the impact on our critical care services and also, of course, sadly, when individuals die within our services and are unable to be supported in the appropriate manner. So the mortality rates within our areas are quite important. Now, if I'm looking at our current figures, we are seeing some early evidence that perhaps hospital admissions, while still at a higher level than we would wish, have started to stabilise, particularly over this last week or so. But I worry that we will still have to wait another couple of weeks or so before we really see the impact on NHS services more generally. And perhaps as an aside, I could just explain to you that we are seeing some changes perhaps around our experience in critical care and the nature of patients being cared for in there. It does seem to be the case that there is some success in this second wave of actually treating patients earlier with some of the interventions that we've learned work, using the evidence that is around and available. And both for ourselves, but also across the UK, we're actually seeing a lower mortality rate at this phase. But again, I'm concerned that perhaps critical care is not quite yet experiencing the numbers that we would expect, because there's always a 2 to 3 week lag behind the admission of patients.
Thank you. One more, if I may. Would you like to see mass testing in Wales like that in Liverpool? And if so, what moves are being made to make that happen?
First of all, really important that we are able to ensure that we have the testing capacity available that we can process in a range of different areas, whether that's for the broader community, whether it's what we need to do for our clinical services, or indeed what we need to apply in vulnerable areas like care homes. We are currently working our way through some choices about how we can continue to develop the test, trace, protect mechanism across Wales. We've been using the firebreak period to review and revisit that. And certainly in respect of areas that have higher levels of prevalence, one of the issues that is under consideration at the moment is actually whether there would be an ability to do some more targeted mass testing of individual areas. And you are right, James. The announcement about Liverpool acting as a city area that is going to go through that, we may well have some opportunities to do similar in Wales. So we haven't resolved that quite yet, but we are involved in a number of discussions about choices that may allow us to support some of the targeted actions in our communities in Wales. James, thank you very much. Just moving next to Anna Lewis from Wales Online. Good afternoon, Anna.
Good afternoon. I just wanted to touch on what you just mentioned, James, just there. We've seen that you've mentioned that the number of people in hospital with coronavirus is now only 9% lower than it was at the peak. But looking at the numbers of people in ICU and critical care, that's only half of what it was at the peak. You've touched on that, but we're wondering, could you explain a bit fully about why there is that difference now?
Yeah, it's always difficult, Anna, with our numbers to ensure that we give ourselves a bit of time to work it through. But by now, at this stage, I would have expected, if it was the first wave experience, to have seen more coronavirus patients in our critical care areas. And you're right, at the moment, we are at about 60% lower than the peak that we saw in April at this time. I think that's a good sign, of course, because we don't want patients to be in critical care with coronavirus. We want them to be supported and to be able to be discharged home safely and back to their family arrangements. But there is clearly evidence from our clinicians about people having been put on earlier intervention. So with the high level of testing that is going on across Wales at the moment, it does mean that we're identifying people with coronavirus earlier. That means that if an intervention is required, we're able to do that earlier and provide the treatment that's necessary. And when patients are coming into the hospital environment, one of the things that we've also learned is the ability to put particular patients on oxygen therapies. It's part of a respiratory pathway that we have patients on as well. And that is seeming also to be a more effective way, rather than perhaps some of the use of ventilators in ICU, which was the experience during the first wave as well. But certainly, although the numbers in Wales are smaller, if I look at some of the UK numbers, this seems to be a shared experience across the UK, that hospital admissions may be going up, but critical care seems to have been much more successful in the way in which it is caring for patients, and the mortality rates currently seem to be lower. And perhaps if I could add, we are currently seeing a smaller proportion of our hospital admissions going into that critical care environment, as you said.
Great, thank you. I also want to ask you, you mentioned that obviously more work now is going on in the NHS to carry on routine work and care. How is this affecting the workforce who are also dealing with rising hospital admissions for coronavirus? And if those ICU numbers and hospital admissions due to COVID continue to increase, how will the staff deal with that, dealing with both factors at the same time?
Thank you, Anna. So first of all, if I could just reiterate my thanks to all of our NHS and care staff who are working across Wales. They are very tired at the moment, Anna. They have been affected by this personally as well as professionally, as all of us have been. And I think we just need to recognise the extraordinary efforts that they are taking to make sure that we have services available in Wales, and that we are trying to ensure that we're able to increase that range of services as well. We have got support in place for our staff so they can access that, and we've been enhancing that as we learn more about how traumatic the experiences can be for some of our areas. But you're absolutely right. When I said in my introduction that we now have twice as many non-coronavirus patients in our beds as back in April, I think it just shows you how much busier the NHS in Wales is than at that time, which obviously affects the capacity and the workforce that we have available. And whilst we do have plans for expanding activity and expanding capacity, like into the field hospitals, ultimately, even with some increases in our staff, it's still the same workforce that needs to respond to all of these pressures as we see things potentially continue to increase. So I'm concerned to make sure that whatever arrangements we put in place are done on a staged basis. that there may well be local decisions that are needing to be taken at the moment by individual health boards to balance between planned activities and emergencies, because they have to prioritise what's coming in through the front door. But we hope that we are finding ways to support staff appropriately. We have really good relationships with our unions in Wales. And interestingly, just at the moment, our sickness and absent rate is actually lower than it was at the same point last year, which may be a bit of surprise with everything that we've experienced. But we are definitely seeing an increase over the last couple of weeks of more members of staff needing to be off because of coronavirus, and also a higher increase in a percentage of staff who are now isolating because of the impact of Test, Trace, Protect and the testing approaches as well. But it's really fantastic the way in which the staff have responded over these recent months, but they honestly are tired, Anna, and I think that's why we want to make sure that the public can continue to work alongside us.
Thank you. And if I could just ask the last question, if I may. We've been receiving messages from people who have had their care postponed or haven't been able to get appointments due to the coronavirus pandemic. What would be your message to people who are facing that position right now?
So first of all, I would like to apologise to patients who've been unable to access services that they need, but I hope that they will understand the extraordinary circumstances in which we continue to respond. The NHS has remained busy throughout all of these recent weeks and months, and it's why, Anna, that I wanted to ensure that the public understood that we are trying to increase the activities that we are undertaking. We're not just staying static, we are trying to make sure that that can continue to increase week on week. We have mechanisms in place to ensure that we're able to look at urgency and clinical priorities for patients. And we hope that we can see patients actually in a very different way from perhaps how we would have last year, because there's been so much change and use of technology that there are different approaches that we can take to manage that. The one thing that I would say is that whilst we can't say when we will be through this pandemic, we will have to develop a plan, and I'm afraid it will be a long-term plan for how we're able to deal with patients on our waiting lists. And we will need to ensure that we're able to invest in extra capacity and support to ensure that the NHS is able to get those patients sorted appropriately and in the right kind of setting. But we are still in the middle of a pandemic, and despite all of our good intentions, we're still not at the point when, I'm afraid, coronavirus has been ended at this stage. And I hope with a balance between vaccines that may emerge over the forthcoming months and also more successful treatment, that we may be able to get in a better place. But I would hope that they can continue to understand the circumstances and know that our clinical staff are trying to do everything possible to get them into our system. Thank you, Anna. Moving next to Steve Bagnall from the Daily Post. Good afternoon, Steve.
Good afternoon. Thank you, Dr. Goodall. You've just touched on this. The First Minister has said the early vaccines won't be a get-out-of-jail-free card. How long do you think it will be before the first ones are available? And do you share the First Minister's view on how effective they will be, and that people shouldn't be holding up them as some form of a silver bullet to solve COVID-19?
Thank you very much, Steve. I mean, it may sound a difficult comment, but I think we have to try to balance the need to bring forward vaccines as they become available alongside being realistic that we're going to continue to have a society that is working in the context of COVID-19. There are some now good examples, both in the UK and internationally, of vaccines that we do expect to be available shortly. We, as a minimum, need to ensure that we have preparations that are able to take place so that should the moment come when somebody says the vaccine is available, we know we can roll it out pretty quickly. There will be an order of priority for how we target that vaccine to the population, and as you would expect, it would start with the most vulnerable in our society. It will start with trying to ensure that we're able to support our health and care staff, and then it will actually move more generally into the population. And I'm afraid that whenever it starts from, and however quickly we look to expedite this on the basis of the available vaccines, it's going to take us some months even to get through what would be the first cycle at this stage. I think the First Minister is right to say that we can't just assume that the vaccine does everything. There will always be issues of effectiveness with any of our vaccination programs that take place. But our hope is, and certainly with some of the potential that is being shown through the trials that are happening, not least in the UK, that there will be sufficient effectiveness that what it helps us to do is to break the chain of transmission that we're seeing across Wales. So I personally feel that we should have hope about this. The availability of effective vaccine would be a game changer for us in terms of the way both we and internationally people are responding to this coronavirus. But I'm afraid it won't be an overnight solution for us.
Thank you. And the First Minister also said yesterday further consideration was needed how the hospitality sector would operate following the News England was having its own forward lockdown. Have any decisions been made yet? And what factors specifically was the Welsh Government having to consider following the Prime Minister's announcement?
So, Steve, obviously, I'm speaking from an NHS perspective about the sector, and the process that is going through for hospitality will be with the First Minister and the Cabinet. And as you would expect, there will be other officials who are involved in that, not least with their liaison with the sector. I would expect that the First Minister will be able to build on his announcements yesterday and actually give some of the further detail and guidance that is necessary for that sector. I think the underpinning concern, however, to help with the understanding of this is clearly the more we introduce times when there can be much higher levels of social interaction, the more potential there is for the virus actually to transmit. And there is a need, I think, to balance access and for people to be able to see loved ones, friends and family, but recognising that the virus just simply will transmit. So I look forward to the First Minister making clear some of the final announcements that will look to apply, not least for the hospitality sector, from next Monday.
And a final question, please. It's just whether you could just clarify where the R rate is in Wales at the moment and which direction it appears to be going in.
Yeah, I mean, the R rate at the moment, we're still on a range that says it's somewhere between 1.1 and 1.4. We continue to keep a close eye on that at this stage. Clearly, with the higher numbers of cases that are being reported in Wales, it does mean that the reproduction rate is much more meaningful at this stage than perhaps it was during the summer with very small numbers of cases. We will have the latest weekly assessment come through later on this week. We have to hope that there will be some indication of some changes around the reproduction rate, but that might still in itself take another couple of weeks if it's to reflect some of the experiences that we've lived through as part of the firebreak arrangements in Wales. Thank you very much, Steve. Moving next to Dan Bevan from LBC.
Thank you, Dr. Goodall. Good afternoon. This statistic that you've given, 1 in 40 cases of coronavirus nationally in Wales are hospital transmissions. That sounds like quite a worrying statistic. Is it something that concerns you? And as you've already alluded to, this is a very highly infectious virus. Is that a number that you'd expect to be about this level for this type of virus?
Yeah, I mean, Dan, thank you for the question. Obviously, I've focused on hospital transmission as part of my introduction here today, and I think that would recognise that this is a very serious issue for the way in which our system responds. You know, there are actions here that we need to take ourselves in overseeing the NHS about looking for our professional teams and our infection control teams across Wales to respond, but also the need to emphasise how all of us still have a contribution to make here in respect of how we approach, you know, social distancing and hand hygiene. I mean, those numbers are smaller, perhaps, than people may have expected, given the overall numbers, as I said. That's around 3% of patients coming into our system at the moment who are reported to have coronavirus. But I think it's enough of a concern at this stage to make sure that we are targeting actions on this. So that's why Public Health Wales are using their own expertise to make sure that we have a focus on infection control actions. It's why you've got areas being segregated, you've got cubicles being introduced, you've got red and amber and green zones being created. We're trying to minimise the level of contact and transmission happening. We're able to enhance the use of PPE. All of these things that can make a difference. But as I said earlier, Dan, this virus seems to require 100% compliance 100% of the time. And I would ask, you know, all of us to undertake that in our daily lives. I would ask, you know, members of our community to do so. And of course, that also means that we need to make sure we're able to comply in terms of our NHS staff as well.
Thank you. And one of the key features of the fight against coronavirus has also been the effect that it's had on people's mental health. And particularly, I want to focus on the people who have been on the front line of the fight against coronavirus. How many NHS workers are currently off sick because of mental health problems? And what is your worry for these people, for the people who work in the NHS and their mental health in the medium to long term?
So Dan, to answer your figures, within the 0.7% who were off for reasons of coronavirus, I have to say those figures are more related to individuals with symptoms rather than a knock-on effect of mental health. If I was looking more generally at our sickness and absence figures, probably around 1 in 4 members of our staff off are for mental health reasons. I can't really tell you this afternoon that would all be to do with coronavirus. But what I would say is that, you know, the impact of what NHS colleagues have seen in their professional lives in a work environment and some of the real difficulties that they will have experienced in services, whether you're a paramedic responding to a case or in an emergency department or in a GP surgery or certainly in a critical care environment. Some of our staff have seen some very difficult things over recent months, including seeing their inability to be able to intervene to care for patients as they would have wished. And positively at this stage, at least there is more that we can do with patients manoeuvring through. It's why we do have support available. We have a health professional scheme that's in place that's hosted by Cardiff University. Originally, that would have been targeted on medical staff, but we've enhanced it during the period of the pandemic to actually ensure that that's available for all of our staff. And we're also working with Social Care Wales on mechanisms that would allow us to support, of course, care home staff and those working in social care as well. So I might just see whether offline we can be a bit more explicit for you on some of your mental health figures, but typically, 1 in 4 of our staff would probably be off for some kind of emotional health or mental health problems.
Thank you very much for answering that. And just one final question, if I may, as well. One of the reasons for the fire break was to make sure that the NHS could prepare itself for this potential second peak that, as you say, might get to around the same level as the first. I wonder, what have you been doing within the NHS over the last week or so and continue to until the end of the fire break in order to minimise the risk of needing a third lockdown?
First of all, the NHS in Wales was very supportive of the fire break actions taken. It was felt that that was necessary, particularly looking at the trends that we were seeing ourselves on our own numbers and figures, and the NHS had an opportunity to be part of the broader discussions that were happening across all sectors. And of course, we've had the data available to support it. And beyond the NHS as well, speaking to a number of representatives around Wales of health professionals, they were also very supportive of the mechanisms that were undertaken by Welsh Government as well. But yes, we've been using the time to ensure that we can commission some of the additional capacity that's necessary and that we can focus on areas like testing. But from an NHS perspective, Dan, we were already responding. We were already seeing an increase in patients. So a number of our plans had already been put in place. Good news is that we're seeing areas like flu vaccination already increasing beyond levels that we saw last year. So the public have seen that that is an opportunity for them to look after themselves, particularly if they're vulnerable. The NHS, I asked 2 weeks ago to be ready to be able to commission field hospital capacity if it was needed to manage some of the pressures within our system and service. We have today got 32 patients in one of our field hospitals in Wales in the Cwmtaf Morgannwg area, but I can say also that the other health boards have also been looking at their own plans, and I would actually expect probably over this next week at least 2 or 3 other health boards to start to bring forward their plans for additional capacity in field hospitals as well. And then also the NHS has been contributing to the discussions on test, trace and protect and the ability to make sure that we're able to maintain the contact tracing mechanisms in place. And I'm still really pleased to report, Dan, that despite a doubling in the number of tests taking place and an enormous increase in the number of people who are now to be contacted and to be followed up, that we're still seeing 94% of the index cases actually tracked down and 95%, and I think it's been over 70,000 follow-ups who've been tracked to date, 95% of those actually being followed up as well. So I think we've got good foundations to build on in our TTP process in Wales, working with local authorities and local stakeholders. But again, there's been an opportunity to see whether we can do anything different on that as well. Okay, thank you very much, Dan. Now moving to Daniel Barnes from the South Wales Argus.
Thanks very much. Can I ask, are you worried that if pubs and cafes, for example, are open in Wales but not in England, people might travel across the border in places like Monmouthshire to visit Welsh pubs, potentially spreading the virus?
So my comment on that would be, it probably goes a little bit above my NHS role, but if I comment generally on it, England will have its own regulations about the way in which individuals can move outside their communities, and the guidance in England is clear that they should not be coming across the border or across areas at this stage because of the national mechanisms that will be introduced on Thursday require that. I think that we need to work with stakeholders across Wales, and clearly the police have done a fantastic job over recent months ensuring that people understand the regulations, but where necessary, needing to make sure that they can actually apply the regulations appropriately so. But I would hope that given the seriousness of the suggested arrangements in England, that the population there would also understand that the more they're able to limit their contacts and more they're able to stay close to their home environment, the more likely it is that we're going to see this chain of transmission break, not just in Wales through any firebreak arrangements, but actually more broadly across the UK.
Thanks very much. Staying on that point, we've had reports of people being turned back at the border in places like Chepstow by the police. Do you think that roadblocks like this are going to become commonplace for the time being?
Well, again, it goes a little outside my NHS role to comment on these areas, but I know the police obviously have a role alongside all of the arrangements that are being put in place for public services across Wales to ensure that if regulations are there, that they are followed, and they have their own choices to do. I think the approach that we've broadly tried to take in Wales, this would be true of the way in which I've tried to describe some of the pressures for the NHS. We want to work with our population, we want to work alongside it, and we do feel that we have an opportunity to have an impact on this virus by actually working together. And whilst there is always an ability to fall back on what the regulations say, I think as the First Minister has tried to outline over this last week or so, what we're really doing at the moment is appealing to how we all behave and how we just need to understand that our day-to-day lives have an impact on the spread and transmission of this virus. So I would prefer to maintain an ongoing conversation with the Welsh population, and hopefully that can be supported then by our other stakeholders, including the police, of course. Okay, thank you very much, Daniel. And moving finally to Andrew Nuttall from the Leader. Good afternoon, Andrew.
Thank you. Figures released yesterday by Public Health Wales show that there was a stark and sort of apparent jump in the figures sort of locally here in our area of Wrexham in the Cynhadledd region compared to its neighbours, say in Flintshire and Denbighshire and the Lakes. There's worry that we've heard amongst sort of the community itself. There was over 100 cases in Wrexham alone yesterday. We obviously don't know what that will be like. Today's figures, they don't come out until 2 o'clock. But there's worry amongst the community about people that still aren't sort of following the rules. Would you be able to comment on those sort of figures and sort of those concerns?
Yeah, I mean, just looking at our figures generally, so Public Health Wales figures that were out yesterday afternoon were showing that the Welsh incidence rate was now 256.5 per for the population ratio that we look at. And you're right to say that, however, we are seeing other examples of that. So there are currently 2 areas who are above 500 on that population ratio, and we have 10 that are over 200. And obviously that is a concern, the more areas of Wales that we see seeing some of those higher numbers at this phase. I mean, your comments on local experiences reflect our concern for the whole of Wales. It's really important that we are all need to recognise the need to adapt the way in which we are interacting. The population may be getting frustrated that some of our core messages remain the same, but honestly, out of the things that make a difference, being really clear about social distancing and that 2-metre rule, and being really clear about your ongoing hand hygiene, and of course the use of face masks in those indoor areas, these are all significant contributions to the way in which we're trying to manage this public health emergency. So I would appeal to everyone to realise that rather than not being able to help us here, they all have a very individual experience, and if we can do that for the whole of Wales, this is a virus that we can hope that we can contain and get under control.
Thank you. And secondly, with a new virus itself in circulation, are you worried that because this is just a general sort of extra pressure on the NHS, regardless of how big or small it is, are you worried that a virus that wasn't around last year is going to cause a knock-on effect to the NHS anyway, regardless of what sort of impact people do have on it with these new measures?
Yeah, this is a difficult time of year, and I've commented on how challenging I think this winter period is going to be, and I particularly focused on that in the last press conference that I did as well, because we've got a number of different factors coming together here. We've got the normal winter pressures, we've got the coronavirus impact. We have to make sure we have plans in place in respect of arrangements for EU exit at this stage. And there are, as you said, the normal sort of winter experiences. The other difference at the moment is, of course, that our NHS is much busier generally, as I've tried to describe here, than back in March and April. So one of my worries is that some of the resilience that we would have had in March and April, because beds were available, because we stopped activities, is now less available to us because we are trying to maintain our general approach to activity. But I am worried about it. If I was to be hopeful, I would say that it looks like that some of the Southern Hemisphere experience has had less flu this season. All of the hand hygiene things and the social distancing things that are being done actually stop the spread of flu as well. But I think we will need to keep a very careful eye on this. And the one thing that is very different at this time, last year during the winter, despite all of our pressures and any delays that we experienced, we didn't have 1 in 6 patients with coronavirus in our beds. Okay, thank you very much, Andrew. I think at that point I'll thank you all for your questions. Thank you very much. Diolch yn fawr iawn.